Thank you and good afternoon. So for today, we'll start off with the case update, and then we have our COVID data update today. So today we have 1,205 new cases diagnosed in British Columbia, bringing the total number of people diagnosed with COVID-19 to 116,075. The new cases, 301, are in the Vancouver Coastal Health Region, 730 people live in the Fraser Health Region, 38 people are in Vancouver Island, 69 people are in the Interior Health Region, and 66 people are in the Northern Health Region, and one is a new case in a person who normally lives outside of Canada. We currently have 10,052 active cases across the province, of whom 409 are now in hospital, 125 in critical care or ICU. There are 16,217 people under active public health monitoring and 104,331 who have recovered and are no longer infectious. We've had 3 new deaths from COVID-19 in the past day, bringing the total number of people in British Columbia who've died from COVID-19 to 1,524. As always, our condolences go to families and caregivers and to the communities who have lost loved ones. We have no new outbreaks to report and 7 active outbreaks now in long-term care, assisted living or independent living, and 5 in acute care centres. To quickly go through the vaccines, we've delivered 1,235,863 doses of all 3 of our COVID-19 vaccines in British Columbia. And today, anyone over age 55 is eligible to receive the AstraZeneca vaccine from pharmacies around the province, and people 64 and older, and Indigenous peoples are and people who have received their clinically extremely vulnerable letter can book appointments through our Get Vaccinated program. So let's move on to our data update for this month. To start with, this is the geographic distribution of our cases of COVID-19 by health service delivery area. The graph on the left in the blue is the cumulative cases by geography since the pandemic started, and on the right is the last 7 days. And as we can see, and what we've seen in the numbers that have been reported over the last few weeks, we've seen a transition. There are some areas that continue to have ongoing high rates of transmission, and in some areas we've seen different hotspots show up in the last few weeks. And this becomes more apparent when we look at it by local health area. And I know in some areas of the country, they use things like forward sorting area from the postal code. But for us, the local health area is an area that we understand where health resources are, and it's useful for us in understanding risks in the context of our health system. So that is our cumulative geographic distribution by this local health area, and we can see that there has been ongoing challenges in several areas of the province, and most particularly, of course, in areas like Surrey, in some parts of Vancouver Coastal most recently as well. If we look at the last 7 days by area of residence, we've seen a transition in the north from the northwest to the northeast, and partly that is because of the vaccination program that we've had in communities across the north that have brought down rates of transmission in some of those communities, and Prince Rupert is an example there. We have ongoing challenges and high rates of transmission in many of the HSDAs in our local health areas in the Fraser region, particularly in and around Surrey and the Tri-Cities area. These next 2 plots are what we call dot plots, and I want to present these today to give you an idea of some of the data that we look at by geography on an ongoing basis and have been using to help us direct where we know transmission is happening in communities, but also our immunization and outbreak response programs. So this one shows the average daily rate of new cases per 100,000 population. So this is a rate of where we're seeing the most transmission in communities around the province for the week of April 7th to 13th. What stands out here, of course, is the local health area called Howe Sound, and that includes Whistler. And this was one of the pieces of information that we used to address the outbreaks that were happening in Whistler since January, and we've seen this rate fluctuate because of the outbreak measures that were taken there, and it is one of the things that we use that help drive the decision to provide immunization to workers in the community in Whistler. We've seen ongoing high rates of transmission in Surrey. That's something that's been steadily a high transmission area through most of the pandemic. And of course, you can see here that Peace River South, which includes places like Dawson, are showing up right now, as well as Windermere and Revelstoke in parts of the interior. The next dot plot is total case counts. So the two of these taken together give us an understanding of where rates of transmission are highest, but also the burden of COVID-19 in different communities. So these are two of the pieces of information that we have been using over the last months and weeks to try and direct particularly our outbreak response programs, and that includes things like rapid testing, having increased testing available in certain communities, and also now immunization. And this is why we are focusing, for example, our worker program, which we have started up initially. We were using the AstraZeneca, the Covishield vaccine, to target these communities and people who were in higher risk workplaces that we've identified. We're now using this to ensure that we are targeting the key workplaces where we're seeing transmission and where we need to protect people like our first responders. So we've seen transmission in Surrey, for example, and that's why we're focused on fire and police services starting in Surrey, starting in some of the other higher risk communities as well. And that will, over the next few weeks, and ensure that we're able to, by area of risk, provide vaccination to all first responders. We've also been using this type of data about where risk is greatest to target our school and childcare worker program as well. And as you know, we started in Surrey with the Surrey School District for these very reasons, that we know that the risks of transmission in the communities are highest in the Surrey School District, and we'll present some more information on that. So I just want this information to be out there so that people understand how we're making some of those decisions, sometimes very rapidly, as we see developing cases happen in different communities around the province. Going back to some of our epidemiologic data, this is the daily cases, hospitalizations, and deaths by date of report. And what we can see in the green at the top is that we had a dramatic increase in the third week of March. And this was during the period of time in the middle of the spring break where we started to see a lot more social connections and activity and movement of people. And this has led, along with the fact that we have higher transmissible variants of the virus circulating in communities, to a dramatic increase. We are starting to see a slight blunting of that in the last week due to the actions that we took about 10 days ago. What is also concerning and a lagging indicator is the increase in hospitalizations that we've seen in the past 2 weeks. On a positive note, we've seen a dramatic decrease in the rates of death, and that is important as well, and is testament to how well the vaccine is working at protecting people. And we'll talk a bit more about the hospitalizations and why we're targeting our immunization programs where we are in a minute. The next epidemic curve shows our cases by health authority, and not surprisingly, there's a large proportion of cases are in the Fraser Health region, although we have seen increases across the board in the last few weeks. The This is the epidemic curve by source of where we believe people have acquired their illness, and this is by date of onset of illness, so it looks slightly different than what we saw previously. And as we can see, as we've had this dramatic increase in numbers of cases, it's been challenging to predict where people, or to determine where people were exposed to COVID-19. And that gives us also an indicator of broader transmission in the community. It's one of those things that we look at very carefully about if people are if cases are arising where we don't link them to a known case or cluster. And this is happening more commonly in the past 2 weeks. This is an important slide. It looks at our daily case count by age. And as we have seen and been talking about for the last few weeks, we've seen a dramatic increase, particularly in the 19 to 39-year age group. We've also seen increases in the 40 to 59-year age group and 60 to 79 and the 5 to 18 as well. But the largest and steepest increase has been in younger people, both from social connections but also from work connections. And we know that those interact in what we call social networks. But what we are seeing is that those social connections, when people bring it into a home, where before, if there were 10 people in a household, we might see transmission to 2 or 3 other people at most. Now we're seeing, with the new variants in particular, that transmission can be widespread in households. It may be that all of the household becomes affected, and it's the 40 or 50-year-old parent who ends up in hospital. And this has been played out particularly in the Lower Mainland, but we're seeing it now increasingly in other parts of the province as well. When we look at our daily case rates by health authority, we can see that that things are really driven by Fraser Health and Vancouver Coastal. We've had high rates across the north for some time, and those have been leveling off and coming down. Some of the other important metrics that we look at carefully are the percent of people who are testing positive every day, and that rose quite high to around 12% in the province. It's slowly starting to decrease again, which is good news, but the numbers are still, of course, very high. This is a summary that shows you the impact of the immunization program by age, and most importantly, we can see how protective the vaccination program is against hospitalization, but most importantly as well, deaths in older people as the immunization program has been ramped up. And that is what we are looking at for the coming weeks and months. We've been talking a lot in the last little while and watching carefully about hospitalizations, and younger people are in hospital, and by younger people we've seen an increase particularly in people 40 to 59 who've ended up in hospital in the last few weeks, in particular since the middle and end of March. We've also seen a rise in the 60 to 79-year-old age group. That has been the numbers that have been highest in historically, the 60 to 79. We've seen a leveling off and a pretty steady rate of people over age 80. And why we have seen a slight increase in people 20 to 39 who need hospitalization, and the rates in that group remain relatively low. So really what we're looking at is hospitalization is now being driven by people between the ages of 40 and 79, and that's why it is so important that we continue to focus our age-based immunization program on those down to age 40 in particular. But we know that this vaccine not only protects against some transmission, but very importantly protects against severe infections, hospitalizations, and deaths. This is just another representation of that, which shows that we are seeing hospitalizations increase in the 40 to 59, 60 to 79, but deaths are pretty much concentrated on the older age groups, and they've come down overall with the immunization of older people, but we need to focus on trying to prevent transmission and illness in that age group continually. Again, this is an updating of the percentage of our cases and hospitalizations, and it shows that we continue to have lower numbers of cases compared to the population in the younger age groups, which is good news. That we have seen an increase in 20 to 29 and people who are sick with COVID, but really the dramatic increase that we've seen in hospitalizations continues to be driven by people over age 50 and people in ICU over age 60. We've been adjusting our strategy around variants and their impact in our population, and I've talked about how we are going to be moving from presenting numbers out of context and including this in our surveillance reporting going forward. What we have here is just a representation over the last few months since variants were really became an issue that we needed to understand. We have been doing whole genome sequencing to confirm, so that's the only way to know for sure that a variant is one or the other. And we've had a number of tests that have been developed in different laboratories in the province that test for specific mutations. We now know that certain combinations of mutations are associated with certain of the variants of concern. In particular, we have a pretty good screening test now for B117, which is a large proportion of the variants that we're seeing causing disease in BC right now. So we no longer need to do whole genome sequencing on all of the people who screen positive for the B117. We will continue to do a sample of 5 to 10% of the ones who screen positive for that combination of mutations over time. And we will continue to look at all of the people who screen positive for the P1. And the reason for that is the types of tests, the screening tests that we have for other variants look for mutations that are common to many different variants. So you can't tell for sure if it's a P1 or a B1351 just by the screening test. So we'll continue to do whole genome sequencing on all of those so that we're not missing any new variants that come up that may be important in terms of transmission in the province. And we're going to now, we have moved now as well to doing a random sample of tests from around the province that are positive COVID tests from around the province and doing whole genome sequencing on those so we have an understanding of what proportion of different variants we're seeing in different parts of the province and are able to detect if new ones of concern arise. As well, we'll continue to use our whole genome sequencing to help us understand outbreaks that are happening in different settings around the province, and that's been very helpful for us from the very beginning, as well as making sure that we're able to understand if people are getting sick after vaccination, whether there's a reason to be concerned about a specific variant. So that is our strategy for identifying and understanding what's happening with the changing viruses that are causing infection in British Columbia for the future. And what will show up is this type of information in our weekly surveillance summary that's posted on the BC CDC website every Wednesday morning. And this will give us an ongoing look at where we are in terms of variants across the province and which ones are causing most illness. And as you can see, looking at the week that ended on April 10th, we're up to just under 60% of cases in the province are likely a variant of concern versus the other types of other virus strains that are still causing infection. And so that's that green line. When we look at what ones were causing infections in British Columbia, the two that have a high transmissibility are P1 and B117 that are predominating, but it's not equal in every part of the province. And this gives you an estimation of, though it might be 50-50 almost, at a provincial level, by geography, what we're seeing is that in the Fraser Health region, the number of the percent of cases that are caused by a variant is slightly over 60%, and the majority of those are the B117. And the picture is slightly different in Vancouver Coastal Health, where we've had a number of different introductions of P1 and transmission chains in different areas of Vancouver Coastal. And in Vancouver Coastal, over 70% of new cases are caused by one of the variants of concern, and the most common one is the P1. When we look at other parts of the province, the proportion of variants causing illness varies and is much less, and it is varied primarily the B117. So this is the information that we are going to be using going forward to help us understand which types of the virus, which variants of the virus are causing illness across BC. I now want to give a little bit of information of some of the summary data that we've put together, focusing on Vancouver Coastal and Fraser Health, the largest school districts, to understand what's happening in our school settings over the past year. So this is an overall graph that shows on the top all ages, so people who've been infected with COVID-19, so that's the overall epidemic curve. And on the bottom in the gray is students between the ages of people between the ages of 5 to 18 years. What we saw on September 10th is the start of school, and then the two gray bars represent the winter break and the spring break that we've seen recently. In both cases, we saw an increase in cases in the community during those holiday seasons. Those holiday weeks, and particularly in the spring break that we've just seen in March, we saw an increase both in overall cases in the middle of that, as well as in cases in young people. And that, of course, has led to increased exposure events in schools when the spring break ended 2 weeks ago. Overall, we still have a relatively low infection rate amongst school-age children relative to their proportion of the population, and that's particularly true for ages 5 to 12, where it's still underrepresented. In the last few weeks, we've seen transmission in people ages 13 to 18, and that has caught up to the percent of the population. Other things that we watch very carefully, of course, are deaths and hospitalization in school-age children. We continue to see that school-age children are less likely to be infected with COVID. It's about 1 in 200 who require hospitalization. So again, a tenfold decrease from adults. So we have all along tried to find ways to understand in more detail the investigations that are done in schools. And so what I'm going to present is just an overview of two of the in-depth reviews that have been done. The first in Vancouver Coastal was done between September and December, so when school started last September up until the Christmas break. And the second, in a very similar way, was done by the Fraser Health Authority for schools in Fraser Health starting in January and ending with the spring break. So this is these data are from the detailed case investigations and contact tracing and outbreak and cluster investigations that are done for every exposure event in schools. So when we look at the findings from Vancouver Coastal Health, we're talking about 124,000 students and staff who were in the school system. So it was excluding students who were homeschooled or who were doing remote learning. And we had 699 COVID cases amongst the students and staff that were participating in in-school learning. And 3/4 were in students and 1/4 were in staff. So less than 1% of the 124,000 students and staff who were in schools were cases of COVID between September and December. Of that 699, 55 were cases where people who likely acquired their COVID in the school setting. So that is reassuring to us. About 8% of these cases were acquired whilst in school. And typically when a transmission did occur in a school, on average, that led to 1 or at most 2 additional cases in the school. So this tells us, importantly, that despite what was happening in the community, that schools are a relatively low transmission environment, and that the measures that are in place in Vancouver coastal schools during that period of time were effective in preventing widespread transmission in the school setting. This is a summary of the cases in schools and students and staff cases relative to cases in the community in Vancouver Coastal. So the top dotted line is cases in the community, and as we see with the spring break start and stop, we had a rapid rise in cases in the community. We saw that rise as well in student and staff cases, but that has leveled off and started to decrease once school started again after the spring break. It did, however, lead to quite a number of potential exposure events in the schools after spring break. The second study is a very similar analysis that was done in the Fraser Health region, and it involved 315,000 staff and students in the Fraser Health region. And we know that in that period of time, we had very high rates of transmission in some communities, in particular in Surrey and North Delta and Abbotsford. Of the 315,000, slightly less than 1%, 2,049 cases of COVID-19 were identified among students, the majority of them students, about 83%, and staff, 17%. Of those 2,000 in some cases, 267, or about 13%, were associated or likely acquired in the school setting. So again, very similar to Vancouver Coastal and aligned with what we saw in Vancouver Coastal in the previous period. And typically when a case was identified, a transmission happened in a school is to one other person in that school setting. And importantly, no transmission was identified in 85% of schools in the Fraser region during this period of time when we know there was high transmission in the community. So again, just representing the community versus students and staff cases, it really shows us that student and staff cases follow the trends in the community, but that when they're in the structured school environment, the rates of transmission are much, much less. Having said that, it is absolutely clear that every exposure event is disruptive and concerning, and we've learned what are the measures that are important. We've been working with the schools to ensure that the COVID safety plans in every school are being followed, that people are doing what they need to do to reduce the anxiety, to reduce the probability that cohorts and even schools may need to be closed for a period of time. And that's why it is so important, and we've prioritized school staff for immunization, and starting with the areas with highest community transmission, and we'll be working through all school staff in the province over the coming weeks. So the key things that we've learned is that COVID-19 cases in schools reflect what's going on in the community around them. Most of the cases in the school setting were required outside of the school, and there was little transmission within the school itself. So it does not as well appear to be a major driver of community transmission. And I know there's a lot of talk about we need to close schools to stop transmission in the community, and we're not seeing that as an issue. So this is important for us. These are data that we've been following, we've been sharing with the school community in the regular meetings that are happening at the provincial level, because we recognize how important school is for families, for communities, and for children. So reassuring, it certainly is something we continue to pay attention to, and we know how distressing it is when we have exposure events, and we need to all continue to pay attention to what keeps things safe in the school setting. Finally, I want to update on where we are with a modeling that we look at on a weekly basis to help us understand what potential things could be happening in the future. We have been above 1 in our reproductive number for some time, and that, of course, we see in the reflection of the transmission events that we've been seeing around the province. And this has been all over BC. We have started to see a slowing or bending back down of the reproductive number, which means that people are reducing those contacts that they have where the virus can be transmitted, or those infectious transmissions. And that is important. We saw a lot of movement of people and social gatherings over the period, particularly of the spring break, that led to rapid rise in transmission. That was fueled, of course, by the fact that we have some viruses that are more easily transmitted that are circulating in particularly the highly populous areas of the province. We see that in the Fraser Health region, where it's still, the reproductive number still remains high. Vancouver Coastal starting to come down again with some of the actions that we've taken in the recent weeks. And we see that as well in Fraser, where reduction of even some of those settings where transmission was happening has made a difference in reducing those rates of transmission. The rates, of course, are less stable in the smaller health authorities, the less population, less transmission, but we are still seeing concerning transmission in parts of the interior where Vancouver Island and North are coming down again, and seeing some of the important measures that we've taken in communities in the North having that positive impact on transmission. And finally, looking at where we could go in the future. So right now, the rate of infectious contacts, so the contacts we're having where the virus can be transmitted to others, on average in the province, is somewhere around 55 to 60%. That is too high. We know what we need to do to bend that back down. We need to get down to 40% or less, and we have done that consistently. We were able to do that last March. We did that in November when we put in restrictions again. And I want to remind people, the restrictions that we put in that worked in November are still in place. And I think we've all felt this need to have some of those social interactions again, and perhaps a sense of complacency around those. We need to pay attention again. We want to be able to have interactions and connections, whether it's for work, whether it's for school, whether it's for those needed social connections, in a way that is safe. And that means following COVID safety plans in workplaces. And we are focusing on those workplaces where there has been transmission, where those COVID safety plans have broken down in some cases. And we know that part of what we need to do to break those transmissions is to shut workplaces for periods of time so that ongoing transmission to that next generation can't happen. As well, we know that that travel and traveling for social connections, for recreation, for vacation, for those social interactions are settings where we have seen transmission happen very rapidly and move back into communities. So now is our opportunity to take a step back again and get us through this next period of time as our vaccination ramps up once more. And we can see that it's not the same everywhere in the province, although we are all facing the same storm right now. And we need to make sure that we're all taking those actions to keep ourselves and our families and our communities safe. Finally, I'm just going to remind people that we do have our population health survey round 2 that is open, and please, we've had about 85,000 people who have responded, but this is your opportunity to tell us once again, what are the things that are impacting you most here in BC? So together, all of the metrics that we've presented tell us some very important things. The people that you are seeing every day, whether at work, whether running errands, going for a walk, it's likely that without you or them knowing it, somebody in your community, in your connections, has COVID, may not be aware of it, and is potentially infectious. The more people you see, the higher that likelihood would be. Right now, we have a lot of transmission in communities across the province. So what does that mean? Even if we can see people outside our household, we shouldn't right now. And if we do, it needs to be the same small group of people. We know that outside is lower risk. It's not zero, but it is lower risk. So have that small group of people that you meet with, that you need to support you. Meet them outside. Keep your distance. If you're going to be in close contact, wear masks, even if it's outside. Each of us has less contact with people around us. We will all see that benefit. Even a small effort can make a big difference in our overall risk in the province. I know many, many people have been very diligent and committed to following the public health orders that we have in place. But we need now for all of us to get onto this path. And I want to thank people who are doing the right thing. But our future path is in our hands now. We know what we need to do. We need to stay close to home. We need to stay small. We need to stop those transmissions that are getting between, that we're spreading between people and bringing it home to our families, our workplaces. We know that COVID-19 is a virus that's transmitted by people to people and to the people that we are closest with. This is our third wave, and we have done this before, and we can do it again. I'm asking everybody to do our part today, to remember that we have it within us to take these small sacrifices every day to get us through this next period of time. We are not alone in this fight anymore. We have vaccines on our side, but we need to buy the time to protect those people who are ending up with severe illness and ending up in hospital right now. We need to do that to protect our hospital system, to protect our friends, our families. And we need to remember that we need to do this in this most challenging of time by being kind to each other, by remembering that we all have the issues that we're dealing with in our lives, and we may not understand everybody's story, but we all know what we need to do today, and we will get through this storm together. Thank you.
Thank you very much, Dr. Henry. I just wanted to, on behalf of the Premier of the government and really of everyone in BC, pass on my condolences to the families, the friends, the caregivers of the 3 people who passed away in the last 24 hours from COVID-19. This is a difficult time in the pandemic, and obviously with the limits on our ability to come together to celebrate and acknowledge and grieve about the ones we've lost. It's a difficult time, and we're with all of those families and caregivers today. I wanted to note with respect to vaccines, and I'll just be very brief today, that as Dr. Henry has said, 1,235,863 doses have been delivered in BC. 1,147,964 of those are first doses, and that's 26.7% of the eligible population of 4.3 million. This week we've received the 138,000 from over Monday, Tuesday and Wednesday, the 138,000 doses of Pfizer that we were expecting. That's arrived over the 3 days. We also received this week 42,900 additional doses of the Covishield, the AstraZeneca vaccine. We have yet to receive this week, although we are hopeful about tomorrow to receive some, any of the 105,900 Moderna vaccines that we expected. To date, we've delivered 902,766 Pfizer, which is, just to put that in context, all of the vaccine that was provided, every single bit of it that came before Monday, Tuesday, and Wednesday of this week, and a significant portion now of that which we were provided this week. So we are up to date on Pfizer. We are down to approximately 30,000 doses of Moderna. We do have more AstraZeneca on hand, but I would note that 78,632 doses of AstraZeneca have now been delivered through our pharmacy network. Yesterday was a record day with respect to the number of immunizations in BC and a record day of immunizations in pharmacy, and we are thankful to all of the teams and staff that have been part of that. I want to briefly update you. We'll have a more significant update on hospitalizations in detail for people in our briefing on Monday. But in terms of overall hospital occupancy, our base bed occupancy is 92.4% across the system, meaning 714 vacant base beds. Of our total beds, which includes base and surge beds, which are 11,939, we have 3,117 vacant beds. With respect to critical care, we have our base bed occupancy in critical care is 80.5%, meaning we have 105 vacant base beds. And in total, the total occupancy when base and surge beds are added, we have 780 total beds, and 339 of them are vacant, for an occupancy rate of 56.5%. We have, at some sites, touched some of our surge occupancy capacity, about 3% province-wide. And as all of you know, the challenge is not equipment. We have a considerable supply of ventilators, and we are not touching in any way our ventilator capacity or our bed capacity. But what it does happen, of course, is when we move into surge beds, it puts significant additional pressure on staff, and that is, of course, an important question. I'd note as well that we do have, if you consider the COVID-19 cases and everyone in acute care hospital, we have, as of today, 8,822 people overall in acute care hospitals in BC. This is not a high level in comparison to pre-COVID times, but obviously with COVID-19, the pressure on our staff is considerable. I just want to note that more than 1 million people have registered since we launched our registration system for vaccination. 1,048,547 people, to be precise, have registered, and 362,857 have booked appointments. I want to encourage everybody, people who have not yet registered from 60 to 64, for example, people who have not yet registered between 50 to 60 in BC, to get on and to register, which will allow you to book an appointment at the earliest possible moment when an invitation is sent to you. In closing, I just wanted to say that was 26.7%. Now over 1 in 4 of eligible British Columbians having had their first shot of a COVID-19 vaccine. We're going steadily in the right direction on the vaccination front, and our teams are doing an exceptional job. But we are not yet close to community immunity to keep us safe. It's still us and the vaccines against COVID-19, and for the vaccines to do their job, we must do our job to stop the spread. I think Dr. Henry made a very important point. We've had significant orders in place that were put in place in November, made tougher in December, and now have had additional measures targeting especially indoor social gathering and social connections. This is a virus that spreads through social interaction, and we must do everything we can right now with these case counts to reduce our social interactions and focus on the public health measures and the public health guidance we've seen, and we can do this together. In the last few days, we have seen a decline in case and in our test positivity, but it is nowhere near low enough. We have a long way to go together. I want to encourage everyone to use our COVID skills without delay and without fail. We must do what we've been taught, we must do what we know works, and we must do what we know it takes to stop the spread. Aujourd'hui, nous annonçons 1205 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 116 075 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 3 nouveaux décès liés au COVID-19 pour un total de 1524 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 409 personnes sont actuellement hospitalisées, dont 125 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to reporters on the line, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up. First, we go to Binder Sajan, CTV.
Hi there. Just wanted to go back to the data from schools. I know both the Fraser Health and the Vancouver Coastal information seems to be coming from before variants of concerns really took hold in BC. So given how transmissible those are, more so than the regular COVID-19 virus that has been in BC, is there a greater likelihood that we could see more transmissions happening at schools?
Yeah, a really good question. I will say that variants were certainly part of the equation, particularly in some of the school districts in Fraser Health during the period of time of the Fraser Health review. And we've done, as you know, a lot of extensive testing when we've known that there was a variant of concern exposure event in a school, and we have not seen increased transmission related to that in schools to date. That is something we are watching. We are assuming, as I mentioned, that that any case is B117 now. So we are taking the same measures of ensuring ensuring adequate contact tracing, immediate contact tracing, and testing and monitoring of families and close contacts related to that. But we've not seen increased transmission in the school environment. Again, it talks to the importance of safety measures and structured environments being less risky than some of the unstructured social connections that we have. But it is something that we're watching, obviously, very carefully.
Binder, do you have a follow-up?
Yes, and Dr. Henry, in BC, we've learned that hundreds of people have tested positive since having at least one dose of the vaccine. I'm wondering if you also happen to know how many people may have died after contracting COVID-19, even if they've had the vaccine, and, if that falls into your expectations. And just wondering, are you worried, or is the data showing you anything in terms of what does this mean possibly for second doses?
Yeah, so obviously that is something we're watching really carefully, and we have linked information, linked data of cases and immunization that we're following on an ongoing basis through the BC CDC. And we have had, as you say, about, last I checked, it was a couple of days ago, there were 400 and some cases of people who were 14 days post-dose 1 who developed COVID. So that is 0.07%. So a very low rate, which is good news. And that's probably an overestimate because people may have been in their incubation period before they had full benefit from the protection of the vaccine. But we want to be conservative on that. And we've had several dozen, it's in the 30s, cases of people who have tested positive, for COVID at least a week after dose 2. So that's 0.04%. So very small rates compared to what we're seeing from similar communities or similar transmission events in the community where it's much, much higher. The protection is long-lasting and very good from the vaccine. That's great. I'm not aware of any deaths in people who have been immunized and developed COVID afterwards, but I have not had the latest numbers. I know that my colleagues in the immunization program at BC CDC are watching that on an ongoing basis. There was one death in a long-term care home after immunization in a person who was over 100 years of age.
Next, we go to Richard Sussman, Global News.
Dr. Henry, you mentioned we largely have the same restrictions in place now than we did in November and December when we started to see that curve go back down. But what we have now is variants. So what are we doing to factor in those variants in terms of overall spread of the virus?
Yeah, so The thing we need to remember is the variants are more transmissible, but the things that stop transmission are the same. So it is about the number of people that we are in close contact with without using our protections. So that means indoor environments are riskier than outdoor environments. We have larger numbers of people. If we're talking loudly, if we're singing, if we're in a poorly ventilated area, those are riskier situations, and there's no margin for error right now. So it means that it's more likely that you're going to transmit to more people in those situations. So it doesn't mean that the situations and the things that we need to do are different. It means that what we're seeing is you're transmitting to more people when you're doing those things that put you in that risk situation. So your probability of being exposed to somebody is higher now because we have higher rates of transmission in the community. So if I am seeing a group of 10 people, the probability that one of them has the virus and is potential to spread it to me right now is highest than it's ever been. So we need to pay attention to what we know works to prevent those transmissions. And that means staying small, staying outside, wearing masks, keeping our distance from people. The things that we know stop transmission have not changed. What has changed is our risk has changed because this virus is transmitting more easily. So we have restrictions on indoor gatherings with your household only. We have restrictions on numbers of people who can be in a business. We have COVID safety plans that work, but they need to be followed. And that's one of the reasons that we've put in place the protocols that we now have with WorkSafe so that we can target those specific businesses where this is happening and support them to prevent transmission. It also is why we've had to do things like reduce some of those situations that were okay even a few months ago. Indoor dining was a structured environment where there was some risk, but the risk was low enough. And now it's higher because of the variants. So that is one of the reasons why we moved and mitigated that by having takeaway and outdoor dining only. So the risk is not zero if you're sitting on a patio with somebody right now. The risk is less, though, than inside. And we were seeing transmission to larger numbers of people in those inside environments. So it is the same things, but we all need to be doing them now. And really importantly, we saw a lot of people moving about. And then when we move about and have contacts with people in another place, we're bringing the virus with us, and we're bringing the virus home with us. And that's where we saw spread of transmission across the province.
Richard, do you have a follow-up?
Your dynamic modeling here shows if we continue our current contact behavior, we're going to be hitting close to 3,000 new cases a day by the end of April. Right now, at 1,200 new cases a day, we are seeing hospitalizations at record-breaking numbers. So if we don't amend our contacts, what does that mean for our hospitalizations? And also on a side note on vaccinations, now that we're aiming towards vaccinating school staff, police, and fire, how much of that Moderna Pfizer is being moved from the age-based to those priority groups that you've committed to vaccinate?
Yeah, so in terms of hospitalization, yes, it's a lag indicator. So we know that as rates go up, 5% of 1,000 is more than 5% of 400. So we will see hospitalizations. And that's why the age-based program is so important, why we need to maintain the protection from vaccination for people down to age 40 in particular. But, they all converge at one point. And that's why we've been targeting the AstraZeneca that we have to anybody over age 55 to try and increase our protection in that lower of that age group. And in terms of, we have always had a stream, a parallel stream, that we have used for outbreaks and for management of clusters and cases in different communities. So it is from that part of the stream that we're using to continue the worker program that we'd started. So it's a very small percentage, about 10% of the overall product. So it's using the AstraZeneca to supplement the age-based program, recognizing that we will all get there and we have more vaccine coming. It just wish we had it today as opposed to in May and June. So it is a spacing out, and that's why we've had to do this by area of risk. So not every school, not every fire service will be done this week. They'll be done phased in over the next few weeks.
Next, we go to Lisa Yusta, News 1130.
Hi there. I was listening to the Ontario update today, and your counterpart, Dr. Baber Yaffe, saying that they are in a very dire situation. You mentioned that we're about a month behind Ontario. So are we doing enough here to prevent our very dire situation?
Yeah, I think the comment I made about us being a month behind Ontario, that was in relation to the proportion of our cases that were variants of concern. So we're about 60% approximately right now. Ontario is about a month ahead of us, and they're much higher than that. So it was really only in reference to the proportion of variants of concern that we were seeing in our cases every day. We are charting our own pandemic, and we've said that from the very beginning. We've seen that across the country. There are different population dynamics. There are different population demographics. There's different types of transmission events and super spreading events and introductions that are happening in different parts of the province. So Ontario has been hit hard, and they had come down, but not to a low enough level that they were able to support their healthcare system. Obviously, we're watching that really carefully. We're looking at what we need to do here. And we presented our plan for our strategies for supporting our healthcare system back in September, and those plans are still in play. We're monitoring them regularly. We have the metrics that we are using. We also have a very strong network around the province to support where pressure points are happening in the hospital system, and we saw that in the last few months in the north, being able to decant people who needed care out of the north to other places, and recognizing how challenging that is both on families who have a loved one who's sent to Vancouver Island, for example. But yeah, this is something we're paying attention to in a huge way, and why we put in the restrictions that we put in, why we're focusing on the measures that we need to do in communities to prevent transmission, to reduce the risk of people needing hospitalization. So it's all looking at what we have and our networks and our supports and our healthcare system here.
Lisa, do you have a follow-up?
I'm going to try a double barrel here a bit. You mentioned the hospitalizations, and I'm just wondering what happens to hospitals if we keep increasing and we get closer to the couple thousand, 3,000 cases a day. And also, with all of this, does it mean that isolation instructions need to change? Like I know we've heard from parents and families saying, you know, when a kid is sick or a kid has to isolate, other people are able to continue going to work. Is that too risky now?
And so there's a couple of things around that. I'll answer your second question first. Yeah, we have had a lower tolerance for if somebody in the family is ill, because we're seeing it spread so rapidly in families, in particular in households, that yes, keep the children home from school if somebody's sick. Get tested. Make sure we know what is happening. And the case management contact tracers are doing that. So every situation is a little bit different. It depends on what you do for work, for example, what the risk might be. But yes, It is right now, if somebody in the household is sick, then everybody needs to pay attention and make sure they're getting tested, that we understand the transmission in those environments. So we have a much lower threshold for staying home if somebody's sick in the household right now and not sending children to school. And I've said that a couple of times because of the rapid increase we saw in a lot of social interactions that were happening over the spring break. In terms of hospitals, you know, the models give us a sense of what are the parameters that are most important going forward. It's not a prediction. It's not a prediction that we're going to have 3,000 cases next week. And we've not seen that happen in other models that have presented in the past. It helps us look at what are the things that we need to adjust and where we need to go with those. So, you know, we've put in additional restrictions. People are paying attention, and we are reducing the transmission in our communities. We've seen that a little bit, and we are looking at the hospital plans across the province, and we'll be talking more about that on Monday in some detail.
Next, we go to Daksh Panwar, Red FM.
Hi, Dr. Henry. Thanks for taking my question. I was wondering, a lot of flights are coming from India, and India has a lot of infections, basically. There are a lot of cases of exposure on those flights also. Have you seen any case, have you noticed any case of the variant, that the double mutant variant that is dominating that country, B617 variant?
I'm not, I can't answer that question off the top of my head. I know we have seen a number of different variants. I presented some of them last week, but I can get back to you on that one. I know it is concerning. We have a lot of flights that are coming from India. We have flights that are coming internationally, and we know that that's part of the federal government's quarantine initiative, and we are appealing to people to make sure that you support your friends or family if they're coming to visit you, to make sure they are quarantining appropriately, that they're isolating appropriately. We have a small proportion of our cases every day that are related to international travel. That's something that is always a concern. We know that flights need to come and go for a whole variety of reasons, but it is something that can lead to introductions of new variants, and that is why we've modified our surveillance strategy to make sure we can pick those up as well.
Daksh, do you have a follow-up?
Yes, I do. Thank you, Dr. Henry, for answering that question. My second question is, you had said that we are testing bamlanivimab in Surrey Hospital. So any update about that?
I'm sorry, I didn't quite catch it. Something in Surrey Hospital?
I'm sorry.
Bamlanivimab.
Bamlanivimab. Yes. It's funny, I was just talking with the clinicians who were leading that study yesterday. It has been a challenge to enroll people into that study, but I know that they've got some and are working on that. I don't know the results off the top of my head, but it is being run by we have a critical care reference group that ensures that new investigational therapies and other therapies that are available are done in a way that we can understand their effect. And I know they've enrolled a number of people, but are having some challenges.
Next, we go to Colton Davies, Radio NL.
Hi, Dr. Henry. You said in your early comments earlier that we shouldn't see groups of people right now, and if we do, we should make it small. So I'm just wondering, why not amend the order then for outdoor public gatherings with up to 10 people?
You know, as I said, it's about finding those ways to do it more safely. There's no zero risk right now. We're seeing this virus being transmitted in lots of places. But we know that the order is about indoor gatherings because those are the riskiest settings. I do think it's important for us to go outdoors, and I think all of us should be going outdoors every day and making sure that that's part of how we keep ourselves together through this never-ending pandemic, it seems. But yes, it's an opportunity for people to have those important social connections in a way that reduces the risk. But it should be the same small group of people that you can meet outdoors, keeping your distance, and if you're closer together, wear a mask.
Colton, do you have a follow-up?
Yes. With the modeling today, it shows clusters of COVID-19 in workplaces in primarily the Lower Mainland. It doesn't show interior health, northern health, or island health. And I know you've made clear that the risk of the virus applies everywhere in BC. So I guess the point of my question is, can you explain the extent of COVID-19 clusters in workplaces within interior health?
Yeah, and this is some data that will be available on the publicly posted on the website, and we had an opportunity to discuss some of it earlier. And it really is a question of the data that we had. So the focus of the workplace task group with WorkSafe BC and with the public health teams was on the Lower Mainland. So that the data reflects what was collected in Fraser Health and Vancouver Coastal. So it has not been collected systematically in other parts of the province, but yes, it is happening, and we know it's happening in the interior. We're seeing clusters in workplaces, particularly in the urban areas where workplace risks are slightly different, where there's more people, and that's why things like the indoor dining restrictions apply across the board in the province. The numbers of workplace outbreaks and clusters are much smaller in areas outside of the Lower Mainland, with the exception of some of the large industrial complexes and mining complexes, both in the interior but particularly in the north.
Next up, Moira Whiten, Tyee. Moira, are you on mute? Okay, we'll move on.
Hi, I am. Thank you.
Thank you, Moira.
No, I'm here. Sorry, my apologies. Dr. Henry, we've seen some modeling from experts released yesterday that we're going to overflow hospital capacity if BC remains on the trajectory you outlined today of reaching about 3,000 cases in the next month or so. What is the province doing, why is the province not doing more to reduce the social gatherings, to reduce the travel that we're seeing fuel transmission around the province?
Yeah, so I think that's, researchers and modelers are looking at some of the data. They don't factor in necessarily the fact that we are seeing some impact of the measures that have been put in place. But the conclusions that they have are very similar to what we've presented, and we take their models very seriously, but they are just that. They're models. They tell us what are the important factors that we need to look for. They're not trajectories, they're not predictive. And we also need to put that in the context of what are the measures that we know are feasible and effective in our communities and that will work. So yes, we have said absolutely, you should not be traveling now. And I said neighborhood the other day, but you need to stay in your local community. Go outside, but go outside in your own community. Traveling is what spreads the virus and what leads to transmission events and chains of transmission that move around the province, and we've seen the impact of that. Those are important things to pay attention to right now. We have orders as well around indoor gatherings. We've had restrictions in workplaces. Those are having an effect, but we cannot let up right now. And we're saying the same things as the modelers have saying, that we need all of us collectively to reduce our infectious contacts. So that's reducing those indoor contacts where we're not using masks, where we have poor ventilations, where we're not keeping our distance. That is something we all need to do right now.
Moira, do you have a follow-up?
I do, thank you. And as you noted, Dr. Henry, a lot of the restrictions that are affecting people's day-to-day lives in terms of social gatherings have been in place since November. What exactly are you and is the government doing to signal the importance to people when really a lot of the restrictions are on travel, as you mentioned, are advisories? What are you doing to signal the importance of following them now when it's clear that transmission is happening because people haven't been doing that for the last few months or so?
Well, I think we need to recognize that people were following and are following for a number of months. And yes, we saw that there was some people who felt that they didn't need to adhere to those anymore. And it's hard. We're in that hard period. You know, we have longer days. We want to get out. It's hard that we're going through this again. I think for a lot of people, it's that sense that this is never ending, and we need to, we have this sense of denial or acceptance of things. But it is a wake-up call to us in this last few weeks that these things are important. We're seeing it now affecting our healthcare system. We're seeing it affecting families and communities, and the impact across the province. We look at places like Whistler. We look at places like Prince Rupert. You know, this is a different game right now. The restrictions, this concept that we're in the end game and we can let things go and we can make exceptions for ourselves are things that we all need to pay attention to again. We know that we can stop this virus. We know that we have things like vaccines on our side, so that the end is coming, but we're not there yet. And we're going to see the impact tragically on the people we're closest to if we don't pay attention to it now. And I'm not sure who was it that said that hard things are hard, and right now it's hard. Right now it's hard, but we need to regroup. We need to remember that we are in this storm together, and that we still have a ways to go together.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For the last question, we'll go to Tanya Fletcher, CBC News.
Dr. Henry, looking at the data on workplace clusters, I mean, it's clear in Vancouver Coastal that restaurants are the overwhelming driver. But if that's just looking at staff, since it's workplace clusters, how much of that risk is reflected among patrons, too? As in, can you explain how this data drove your decision to close indoor dining? Was it as much for staff as it was for customers themselves eating at the restaurant?
Yeah, it was a little bit of both, and that's the more qualitative part of the data that's not reflected in numbers. So the investigations that people were doing, and a lot of that is, restaurants, bars, pubs in Vancouver, but also in Whistler and in the Vancouver coastal area. Also a large part in Fraser Health. So it was a combinations of things, and consultation with the restaurant associations. People were following COVID safety plans and were adhering to them, and they were working. But now we started to see a lot more of interactions where people were pushing the limits and not wanting to do what people asked them to do. And we saw that in certain communities, and in those places we saw a lot of transmission both between staff and patrons and between staff and their households. So the social connections that people have spilling over into workplaces, spilling over into people who were in those workplaces in the restaurant sector and pubs and bars. And, it is unfortunate, and I hear from people who work in those industries, people were doing their best, and in some cases it became very challenging. And yes, staff people were becoming ill, and people were pushing the limits, not wanting to limit it to 6 people to a table, wanting to get together and congregate at the end of the night. So and with the introduction of more transmissible viruses that were causing infections, suddenly those little bits of leeway that we had were no longer able to protect people, and we saw lots of infections in some related to some of those networks in the indoor settings. So yes, that was one of the main reasons why we stopped those settings, to move them outdoors. Same thing with gyms and fitness centers. Things that had been working quite well in many places were being taken advantage of in some places, but we started to see across the board increased transmission from some of the group activities that were happening in those settings.
Tanya, do you have a follow-up?
Yes, please, and if we could get an answer in French from Minister Dix as well, thanks. You've cited the data today showing, why it's so important to do mass community vaccinations like in Whistler and Prince Rupert. Surrey continues to see high transmission. So what plans are underway to tackle Surrey as a hotspot? Has the main deterrent so far been its sheer size? And what's your message to people wondering when they'll be prioritized there?
Yeah, so we have been prioritizing, absolutely, making sure that the immunization programs in Surrey are being targeted to those populations in neighbourhoods that are most at risk, and Fraser Health is continuing to work on that. What we've been looking at is looking at the case rates by neighbourhood and the immunization rates by neighbourhood, making sure we're trying to optimize everybody who's eligible to get into the clinic, and I'm looking to community groups to support us in this. I know Fraser Health has been reaching out to many, help us get people over age 55 and 60 in to get their immunizations. We've been connecting with different groups in different parts of Surrey to make sure that we have the right language information for people, that we have leaders in those communities to support people to get out and be immunized. And yes, that's why we've started first with a number of the worker programs, and we've had, again, outbreaks and other clusters that we've targeted with outbreak management that includes immunization. So there is and will continue to be a focus, but the other part is also true. We cannot do a city, the population of Surrey all at once. We just don't have the vaccine, and we need to be able to address people at risk all over the province. But it is the most challenging area right now for sure. And this is where people who are leaders in your community can support each other to get out to the immunization clinics.
Just to agree with Dr. Henry that Surrey is a major priority. It's where we were first done and immunized all those working in education, teachers and education assistants and others who support our education system with respect to police and fire. A very significant proportion of the businesses that we've targeted for immunization to reduce outbreaks are in Surrey. So Surrey's been a priority from the beginning, and it is a priority now, and you look across the province, it's obviously a place that we go. Surrey, c'est une grande priorité de nos efforts de vaccination partout dans la province. On a été vaccinés il y a, je pense, une semaine. On a fait des vaccinations pour des gens de première ligne, c'est-à-dire des gens de la police, et qui battent les incendies à Surrey, bien entendu. Et aussi, on va continuer à mettre cette priorité sur Surrey. Il est évident que 20% de nos cas sont à Surrey, qui a 10% de la population. Cela démontre la nécessité des gens à Surrey de suivre les conseils de Dr. Henry et les règles de la santé publique en premier lieu. En deuxième lieu, de chercher leur vaccination dès qu'il est possible pour eux. Et dans nos deux fleuves de vaccination qu'on fait maintenant, celui de l'âge et celui d'AstraZeneca dans les pharmacies. Donc, il faut que tout le monde à Surrey se joint à notre combat contre le COVID-19. C'est une grande priorité dans la province et ça va continuer à l'être. Merci beaucoup. Thank you very much.
Thanks, everyone. That's all we have time for today.